Hello, I'm Dr. Vince Bellonzi. I want to talk to you a little bit about what I see going on in current society. It's something that's been going on for a long time. It really is the basis of what we call allopathic medicine, and it's what we base a lot of our medical treatment, our medical insurance, and even the way that practitioners practice. I think it's unfortunate that we're so dependent on the diagnosis, because what it does is it tends to limit people's power to really do something for themselves. I really prefer the type of practitioner that practices what we call functional medicine, because if we can help the patient understand more how their body works, maybe determine what is lacking that doesn't let us function, whether it's nutrition or physical activity, if we help the patient or if we help the client or the person get their body to work better, then we've actually solved disease. It's unfortunate that even with the new healthcare laws, the predominant thought, even in what they call prevention, is actually identification of a condition and then treatment. And it's usually pretty aggressive managed care, which when applied to the patient is not really, I think, the answer. If we want to solve chronic disease, if we really want to help people to be healthy, then we really have to have them understand better how their bodies work, the mechanisms of disease, and really how to go about being healthy, rather than, in a sense, waiting and seeing if they get sick. It's unfortunate, the pervasive in our society is this idea that you're okay until you have a diagnosis. And many people go to the doctor, and the doctor will say, well, I don't see anything right now, it looks like you're fine. In fact, many doctors will say, well, you're healthy because my lab work's in range, or the lab work I did on you. And this doesn't really confer health. In fact, there is no practitioner out there that really gives anybody health. They can manage disease, and that's it. So I want you out there as practitioners, I want myself to start helping people to create the lifestyle that creates the functioning body that creates health and wellness. Because wellness is optimal function, optimal physical, mental, and social well-being, not merely the absence of disease and infirmity. That's the World Health Organization's definition. Sometimes I wonder if they really know what they're saying, because optimal function doesn't have really anything to do with identifying and labeling a disease and then doing management with it. You know, if I see that somebody's blood sugar is out of range, I want to talk to them because it's out of an optimal range. I don't want to wait until they're out of the laboratory range and having trouble to a point where they can't manage their blood sugar. And some practitioners won't say a thing until that person has actually created the entire disease process of diabetes. That's late stage. And much of the preventive medicine and wellness medicine that's taught out there is really nothing more than finding disease at an earlier stage and doing something about it. Not that that's bad, but what about preventing the disease altogether? If we can teach people how to have function, if we can teach people how to get their bodies working better, then we've actually created health and wellness. And that's really what I want everybody to work on individually, because really the individual is the only person that can do this. There's no doctor or practitioner out there that can give you wellness. It's really about your lifestyle matching with how your body works. Remember that your body adapts to your lifestyle. It may adapt in a good way, which means you're energetic, you've got physical, mental, and social well-being. Or it can adapt in a maladaptive way and a disease is created. Really, the environment is created and then the disease occurs because the body's not working. But we just don't tend to look at it that way. I have so many patients that come into my clinic and they've been told by the doctor that either they're healthy, yet they still have a lot of complaints, or even worse, they've been told that, well, let's just wait and see, right? You've probably heard that yourself. There's nothing that can be found today, so we'll wait until it's a full-blown disease, and then we'll do treatment. And many times, once the treatment is initiated, at least in the opinion of many practitioners, there's going to be no end to it. The treatment will go on forever. I have patients that get put on a drug because their cholesterol is high, which to me is kind of silly anyway. We're treating cholesterol instead of the patient. But when we actually are able to reduce the cholesterol and the real biomarkers that matter, I've gone back to some of these medical doctors and have them say something like, well, since we had to start on a cholesterol, we might as well just stay on it for their life. No, I'm not going to agree to reduce or take away their dosage. And the thing is that just makes no sense to me. I know there are benefits from some of the drugs as far as anti-inflammatory activity and such, but there's many better, I think, other ways to accomplish the same thing. I'm not anti-drug. I think there's a time and a place where we're going to need people to do treatment. There's going to be people that do develop chronic diseases. There's going to be people that have traumatic problems. The issue is, do we let everybody get to a point of having chronic disease before we step in? Because there's no way to pay for that. I guess we could say that you can make money with the medical system, but with this whole thing, this whole upheaval in the healthcare system, and what's being designed to do is to be able to deliver more treatment, when are we going to start doing more about prevention? And that's why I really enjoy working with practitioners who look at ways of figuring out function rather than just identifying a disease. If I can identify where your body is not functioning and we can address that, then we've at least removed interference to proper function. We've probably actually helped you move closer to wellness. The real answer, though, is going to come down to lifestyle. And the reason that that's now scientifically known, we know for a fact that we have to consider something called epigenetics. If you don't consider epigenetics, you'll never be able to predict the future risk. Just because we find something in your genes does not mean that there's going to be a disease that occurs. The interesting thing is genetics is, first of all, that many people who carry a genetic trait or a polymorphism or some indication that they might have a risk for a disease, not everybody, not even the majority, actually get the disease. It all depends on the difference in lifestyle. So if we can teach people how to match their lifestyle to their genetics, because we know that the genes are a responsive and adaptive organism, not just a template, then we're going to get better results. So I think the future lies, and this is something that we can actually afford, in really getting people to understand that their lifestyle makes up a lot of what's going to happen. Let's break it down to something called emergence theory. If you study physics, it's interesting that many times the physicists will come up with a mathematical formula and they'll be able to predict something somewhat reliable until conditions change. So they had to come up with a theory to explain that. And if you look in physics, there's now something called emergence theory, which kind of covers the basis, which states that in any complex system, if there's a change in state, there will be a different result. That's kind of summarizing it. The human body is a complex, complicated system. If there is a change in state, the environment on the outside, the environment on the inside, we will get a different result. This is now being proven out over and over and over again. No longer can we say, because something's in your genes, it's going to progress toward the disease. What we have to say is, if you do the right thing, you won't get the disease. If you do perhaps something that will allow the environment to be created for whatever disease, then you'll create the disease. But it's really a choice. So remember this, MD Anderson, the big cancer center, they just did a huge study. They wanted to determine, they asked the question, what is the cause of cancer? And the conclusion of the study, even unknowing to them, it was unexpected, was that 80% of the cause of cancer was lifestyle factors. Think about that the next time that you think that you're going to have to deal with a disease just because you have it in your ancestry. Epigenetics. We'll talk more about it in the future.